Your nights have felt like a relay to the bathroom, your sleep is broken, and your confidence has taken a hit. Here is the simplest change you can make this year to support prostate healing and steady your nights. Eat too common, nuts before bed. No pills, no gimmicks, just real food that your body can use. Forget zinc pills. After 50, the issue is not taking more, the issue is absorbing better. Tonight I will show you exactly which 2 nuts to eat, how much to use, and why nighttime is the key window for prostate health, stronger flow, and fewer wake-ups. This is a practical, gentle routine that respects your body and fits into a quiet evening. I am Dr. Katherine Rotker. For more than 20 years, I have worked as a urologist guiding thousands of men just like you away from confusing and expensive supplement cycles and toward a simpler, more effective path. I have seen firsthand the transformation that happens when men discover how to work with their body's own natural wisdom. The problem is not that you need more zinc. The truth is, your prostate needs better zinc. It needs the kind that comes perfectly packaged by nature, surrounded by the exact helper nutrients it requires to calm inflammation and nurture healthy tissue. Too humble, nuts provide this complete prostate protective package. Stay with me. And I will not only reveal what these 2 nuts are and how to use them, but I will also give you a simple 4-step nighttime ritual that can dramatically amplify your results, helping you wake up feeling more rested and in control. If you are ready to finally take meaningful steps for your prostate health, please subscribe to the channel and tap the notification bell. It helps you never miss our science-backed guidance. And let me know in the comments below. If you are ready to learn more, type yes. If you are feeling skeptical about all this, that is perfectly okay. Just type convince me and tell me your concern so I can address it. Before we reveal the 2 powerful nuts, let's first understand the root problem. Why zinc pills are failing you after 50. You've taken zinc for your prostate. You've followed the label, bought a trusted brand, and waited for results. Yet your nights are still interrupted, your energy feels flat, and your confidence hasn't returned. That frustration is not in your head. I see it every week in my clinic. Men who've done everything right, but still find themselves up 2 or 3 times each night, wondering what's missing. You see, your prostate holds more zinc than any other part of your body. This mineral is vital. It acts like a natural cooling system, calming inflammation. It helps manage cell growth and supports the hormones that keep you feeling like yourself. But for men past 50, the body's system for delivering this crucial mineral starts to slow down. Think of it like this. To get zinc from a pill into your bloodstream, your body has to complete a multi-step process. First, your stomach acid needs to be strong enough to break down the pill. With time, our stomach naturally produces less acid. Then, special enzymes must release the zinc. The production of these enzymes also tends to decrease. Finally, the lining of your intestines, which acts like a smart security system, letting nutrients into your bloodstream, becomes less efficient. It starts to miss things. So what happens? The vast majority of that expensive zinc pill you swallow passes right through you without ever getting to the prostate that needs it so badly. To make matters more challenging, many men over 50 are on necessary medications that can block or weaken mineral absorption. Acid reduces like omeprazole, common blood pressure drugs, and statins all make it harder for the body to pull nutrients like zinc and magnesium from food or pills. It creates a perfect situation where your prostate, the place that needs zinc the most, is left starved. This is where nature has a brilliant advantage. A zinc pill is just a single, isolated nutrient. It is like sending one worker onto a construction site without any tools or a blueprint. But when you get zinc from whole foods, it comes as part of a complete team. It is packaged with other minerals like magnesium, with healthy fats, and with protective antioxidants. These are the natural tools your body needs to recognize, absorb, and deliver that zinc directly to your prostate cells. Your digestive system knows exactly how to handle this natural packaging. It is a language your body has always spoken and still understands perfectly. When I hit my mid-50s, I noticed it myself. I finally began to feel what I had only read about in medical textbooks. I was taking the same supplements, kept my habits steady, stayed active, and ate the same balanced meals, yet the results began to feel smaller. My energy dipped faster, recovery took longer, and I noticed subtle signs that nutrients weren't landing the way they used to. Many of my patients described the same thing. They tell me, "Doc, I'm eating right, but it feels like I'm not getting the same return." That shared experience is important because it means your body is still trying. It just needs help with how it absorbs, not what it consumes. The truth is, it's not what you swallow that counts. It's what your cells can use. You could take a perfect diet or the best supplement, but if absorption is low, the benefits stop at the stomach. The real measure of nutrition is not in the label. It's in how much your body actually converts into usable fuel, hormones, and repair material. Over time, the internal machinery that helps break down and absorb nutrients starts to slow. Stomach acid, which helps dissolve minerals like zinc, becomes weaker. Pancreatic enzymes, the tools that digest fats and proteins, work more slowly. The lining of the small intestine, which transfers nutrients into the bloodstream, loses some of its efficiency. It's like 3 layers of small resistance, acid, enzymes, and the gut wall, all adding up to a steady drop in how much nutrition your body can pull in from the same meal. Your gut works a bit like an old sponge. It still does its job, but some of what you pour in tends to slip away. When you choose foods that are naturally easier for that sponge to hold, foods with the right mix of fats, fiber, and minerals, the absorption improves again. It's about choosing what your body can hold on to. You may have noticed the signs already. Fatigue that lingers even after rest, moments of brain fog, a heavy feeling in the lower pelvis, or those nightly bathroom visits that break your sleep. These are gentle signals that your cells aren't getting all the building blocks they need. Poor absorption shows up in how you feel, not just in your blood work. Whole foods make a real difference here. They come pre-packaged with everything your body needs to recognize and use nutrients properly. This natural packaging is something supplements can't fully recreate, no matter how well formulated they claim to be. Among whole foods, 2 stand out as particularly supportive for men after 50. They're gentle on the stomach, rich in cofactors that aid absorption, and ideal for nighttime use when your body focuses on repair and restoration. Let's start with the first. The first nut is one you've probably walked past 100 times. Most men think of almonds as a quick snack, something to keep in the kitchen or add to oatmeal. In my clinic, I've seen them turn into something much more. When a patient starts adding a small handful of almonds before bed, the first thing he usually notices is steadier sleep. Within a few weeks, pelvic tension begins to ease, bathroom trips reduce, and there's a quiet but powerful shift in confidence. It's often surprising because it doesn't feel like treatment. It feels like nourishment that finally works. Almonds carry the same zinc your supplements promised, but they don't deliver it alone. Each nut is packed with vitamin E, especially the form called gamma-tocopherol, which supports tissue protection in the prostate. Alongside it come magnesium, fiber, natural fats, and polyphenol, which are plant compounds that help carry nutrients through the gut wall into your bloodstream. This natural teamwork is what makes zinc in almonds easier for your body to recognize and use. Pills isolate nutrients. Foods like almonds bring the full supporting cast that helps those nutrients actually reach your cells. Magnesium deserves special attention. It helps relax the smooth muscle around the urinary tract, supporting easier flow and reducing pressure on the bladder. It also helps regulate hormones and calm the nervous system, which deepens sleep quality. When your body sleeps more soundly, it produces and balances hormones better, giving the prostate time to heal and restore itself. That's why I often call magnesium the quiet partner in prostate recovery. Taking almonds before bed is more than habit, it's timing in your favor. The body's natural repair cycle is strongest at night. Hormones like testosterone do much of their rebuilding work while you rest. Almonds fit perfectly into that rhythm. Their gentle fats slow digestion, just enough to release nutrients gradually through the night, keeping your cells supplied while the repair systems are active. It's a simple shift, but aligning nutrition with your body's clock multiplies its effect. Once your foundation is set with better nutrient absorption and calmer nights, the next step is to bring circulation into the picture. Blood flow is the lifeline of prostate healing. To strengthen that system, we move to a second nut that focuses on improving vessel flexibility and oxygen delivery, the driving force behind true recovery. For Roy, who is 71, and his main complaint was a weak, frustrating urinary flow, he started having a small handful of walnuts each night along with his almonds. About 2 weeks later, he came back for a follow-up with a smile I will not forget. He told me, "Doc, it feels like a faucet that was barely dripping for years has finally been cleared." Walnuts are not just a heart-healthy food. For many men, they're the circulatory engine behind real prostate relief. Walnuts are naturally rich in ALA omega-3s, a plant-based fatty acid that supports the flexibility of your blood vessels. When your vessels stay flexible, blood flows more smoothly, including through the tiny microvessels that supply the prostate and surrounding pelvic tissues. Omega-3s help keep inflammation low, which means better delivery of oxygen and nutrients to where they're needed most. For men over 50, this kind of vascular support is just as important for prostate healing as it is for the heart. Inside those same nuts are polyphenol, natural plant compounds that help protect the endothelium, which is the delicate, smooth lining of your blood vessels. Think of this lining as the key to vascular health. When it is healthy, it produces a molecule called nitric oxide. This molecule tells your blood vessels to relax and flex, which is essential for strong, smooth circulation. This process is not just about your heart. It is fundamental for your pelvic health. Optimal blood flow is the very foundation of your prostate's ability to function properly and heal. By supporting your blood vessels, walnuts create an environment where your entire pelvic region can thrive. Almonds and walnuts work best when they support each other. Taken together before bed, their effects line up with your body's natural repair rhythm. Your body runs on a clock whether you pay attention to it or not. Nighttime is when everything shifts from activity to recovery. Hormones rebalance, tissues repair themselves, and inflammation quietly cools down. This is not luck or guesswork. It's how your body is designed. When you feed it the right nutrients during this window, you give the repair process exactly what it needs at the right moment. Testosterone pulses most strongly during the first stretch of sleep. Prostate tissue renewal follows the same rhythm, peaking overnight. If those nutrients aren't available during that window, the body simply works with less fuel. That's why timing matters just as much as what you eat. A small serving of almonds and walnuts before bed is all it takes. It's light, easy to digest, and doesn't weigh you down, which means you can turn it into a habit you'll actually keep. Think of this nightly nutrition like plugging in a charger. You don't charge your phone after you wake up. You plug it in before bed, so it's full when you need it. Your body works the same way. Feeding it right before sleep gives it the raw materials to restore itself fully by morning. This is where real healing starts to feel easy. You're not forcing anything. You're simply syncing with the body's natural rhythm. And with the right routine, you can start this habit tonight without any guesswork. Now, I want to give you a simple 4-step routine that I share with my patients. This is a purposeful ritual that prepares your entire body and especially your prostate, for a night of deep healing. It's calm, structured, easy to keep up with over time. About an hour before bed, start with a warm cup of chamomile or rooibos tea. These are gentle, caffeine-free herbs that soothe the system without irritating the bladder. This light hydration primes the urinary tract and helps your body begin its natural calming cycle. The early quieting of the system often makes it easier to fall asleep and helps reduce that jittery, restless energy that can keep you up. Once you feel your body begin to settle, take a small serving of nuts. Around 1 ounce in total is ideal. That's usually a small handful of raw walnuts and about 12 to 15 almonds. Please do not eat them quickly over the sink. Sit down in a calm space. Eat them slowly without any screens or distractions while you breathe gently. That combination of nutrients and a calm state is powerful. The omega-3 fats from the walnuts and the vitamin E and magnesium from the almonds start working their way through your system, setting the stage for deep repair while you sleep. If your digestion tends to be sensitive, soaking the almonds for a few hours earlier in the day can make them easier to chew and gentler on the stomach. A small adjustment like this improves how well your body absorbs the nutrients without complicating your nightly routine. When you're done eating, move into gentle stretching. Focus on your hips and lower back. A simple pull of one knee at a time toward your chest or an easy seated twist is perfect. Just 5 to 10 minutes can make a noticeable difference. These movements increase pelvic circulation, ease muscle tension, and help your digestive system move the nutrients where they need to go. Most of my patients tell me they feel an almost instant sense of lightness after this step. Finally, as you settle into bed, take 5 minutes for your breath. Breathe in deeply through your nose, counting to 4. Then breathe out slowly through your mouth, counting to 6. This kind of deep, rhythmic breathing lowers your cortisol, which is your main stress hormone. We know that stress and inflammation are closely linked. This is your final signal to your body and your prostate that the workday is over and the healing can truly begin. This 4-step ritual is easy to remember and even easier to keep. It creates the right conditions for nutrients to work as they should. Over time, it supports calmer nights, better sleep, and a stronger foundation for healing from the inside out. Choosing the right kind of nuts matters just as much as the habit itself. Freshness is key. Nuts should be stored in a cool, dark place to keep their oils from going rancid. Skip the ones with sugar or seed oil coatings. Plain and natural works best. Start with small amounts if your stomach tends to be sensitive or if you sometimes get reflux. Give this practice a real window to work. Stick with it for at least 2 to 3 weeks, night after night. Pay attention to how often you get up at night, how strong your stream feels, whether your sleep holds steady through the night, and how your mornings begin to feel. There's a quiet strength in waking up steady and rested, feeling like your body is working with you again. Many men tell me it's not just about the bathroom trips. It's about presence. It's about moving through the day with patience instead of irritation. It's about finding peace in the small things again. Aging doesn't have to feel like losing ground. It can mean shifting into a rhythm that matches what your body needs now. When you align your routine with its natural patterns, the rewards can feel bigger than the effort. This isn't out of reach. It's something you can take back, starting with what's already in your hands. 3 things are within your control: what you feed your body when you feed it, and how calm you let yourself be before sleep. These 3 levers have the power to bring your energy and confidence back into clear view. Each night's handful is more than just a snack. It's a quiet promise you keep to yourself. Those small, steady acts rebuild the sense of connection and control many men miss. When men choose simplicity over complexity, something shifts. Bonds at home often strengthen. Passions return that felt quiet for too long. A steady self-assurance begins to grow, and no pill can match that feeling. You might be wondering about flexibility. Yes, there's room to adapt. If you have questions about swapping nuts or how this fits with medication, it's smart to talk with your doctor to tailor it to your needs. If you wake to urinate during the first days, it doesn't mean it's not working. Your body is adjusting. 2 to 3 weeks gives it the time it needs to respond. If you like, you can pair the nuts with a small amount of light protein or fruit, but keep it simple. The power lies in the consistency, not the complexity. Tonight, make the swap. 2 handfuls, not 2 pills. Almonds for their antioxidant and cofactor support. Walnuts for their circulation boost. It's simple. It's repeatable. It's yours. Track your nights for 14 to 21 days and watch how your body responds. If you share your experience, your progress might give another man the hope he needs to start. Small changes can create quiet transformations, and this one is in your hands. I'm Dr. Katherine Rotker, and on behalf of my team, thank you so much for watching.